What is dementia? Are you concerned that your loved one may be having dementia with certain memory changes and you're not sure? Are you worried this person may not be eating enough or forgetting common things like where they left their keys or things that they need? Are you concerned that they can't remember details and that they're repeating conversations you just had 15 minutes ago? Or even more seriously, have they become lost or have gotten lost while driving? Hi, I'm Dr. Naznin Jamal, and I'm board certified in internal medicine. My goal is to provide my patients and their family members with education about common diseases requiring hospital admission. Today, we're going to talk about dementia. So, if any of the above are true, you may be seeing the signs of early dementia. What is it? Well, dementia is a decline in cognition or the process of knowing at least one of several neurologic functional categories, including, number one, learning and memory. This is common. Short-term memory is affected. Long-term memory is usually retained in the beginning. They have a variable ability to recognize and identify acquaintances. They will often remember immediate family, but then towards advanced or end-stage dementia, they mistake immediate family for other people. Number two, language. They have difficulty expressing themselves and have difficulty thinking of words. In end stage, the speech may become incoherent, often inappropriate, or even absent. Number three, executive function. They can't plan as they once did. They become easily flustered and have to have help for organizing dinners or barbecues. Number four, complex attention. They may become easily distracted and can't focus on multiple tasks at the same time. They think about tasks that they were able to do when they were younger, but have trouble completing. Number five, perceptual motor. This manifests when they start to have difficulty in tasks that they were able to perform without difficulty in the past. So think of activities such as small appliance use, getting their hair ready. They can't remember how to do these basic things. And then finally, number six, social cognition. Think of increasing disinhibition. Internal thoughts are expressed easily. There's no monitor of speech. Inappropriate comments may be made. Now, there are several types of dementia. One common type is vascular dementia, which often results in a stepwise decline in neurologic function with each stroke, or mini strokes. Family will often report the patient lost a function that was never regained after recovery with stroke. Parkinson's disease dementia. This type of dementia occurs after a period of years after the diagnosis of Parkinson's disease. The symptoms of cognitive decline usually are gradual, but they will manifest after a period of some years. The motor abnormalities will precede the memory loss. Number three, dementia with Lewy bodies. This dementia is often confused for Parkinson's disease. The difference is the timing of the motor and the cognitive losses, which happen early in the disease course. These symptoms of cognitive impairment usually occur after simultaneously or before the movement abnormality symptoms. Family may also note additional symptoms of delusional thoughts and hallucinations. We also have Alzheimer's disease, which is the most common form of dementia, and it can be often age-related. Patients may or may not have family members afflicted with this type of dementia. There's two additional dementias that I will be mentioning. There's frontotemporal dementia and prion disease. We will not discuss these in detail. Now that you're thinking of dementia, think about the types of tests that the evaluation may include, in addition to a mini mental status exam at the doctor's office. Blood tests may include a complete blood count, serum electrolytes, glucose, it's important to know that sugar, blood urea, nitrogen, and creatinine or renal function, folate, B12, thyroid function, and syphilis testing. Here's a special note on some of these tests. Vitamin B12. Many elderly are low in this vitamin. However, the link between low levels of vitamin B12 and the development of dementia is not consistent. There is research and data showing that compared to patients who are not low in vitamin B12, the lack of the deficiency helps improve their cognitive functions. However, there's also data showing that just having low vitamin B12 doesn't necessarily lead to the development of dementia. Thyroid tests. Again, the data is inconsistent. In patients with normal thyroid functions compared to patients with abnormal functions, they perform cognitively better. Thus, the recommendation is to screen for abnormalities in thyroid hormone. Syphilis testing. Testing may be deemed appropriate in patients with certain demographic characteristics and historical factors. The third phase of syphilis can cause neurocognitive changes, but these cases have been very few in the last few years. And then finally, depression, which is so important. There's data to support depression screening in all age groups, but in the elderly, depression symptoms can masquerade as a pseudo-dementia. Treating the dementia can often be used by treating the depression. And by treating the depression, individuals actually performed better in their cognitive functions. Neuroimaging tests, such as a non-contrast computerized tomography of the head or a magnetic resonance scan of the brain, such as an MRI, can evaluate for possible structural impairment, such as a tumor or an enlargement of the brain's ventricles. Hematomas, which are collections of blood, have also been found in patients who've had trauma, such as falls, weeks to months later. Your physician may choose to order additional tests, such like a SPECT scan or a PET scan, but these aren't the standard of care and will differ per patient. And then genetic testing may or may not have a role. This will depend on your physician's workup. Dementia is a challenging disease, and it's quite debilitating to the affected individual and their family members. It's incredibly hard on direct caregivers as they find that they're having to provide more care to the affected individual. Please seek an in-person evaluation with your loved one's primary care provider to finally get a full workup of whether or not they have dementia.